Jaffe, and welcome to another short video we're going to do today. We're going to be talking about exercise, a subject that I'm sure you're all interested in. I have with me Patricia from the Ascot Cardiology group. Welcome.
Hi.
Patricia.
Hi, Warwick.
Well, tell us a bit about exercise. First of all, can you tell us about what we should be doing as healthy people as far as exercise and what the guidelines are that we have to sort that out?
Right, so apparently the European guidelines recommend approximately 150 minutes of moderate exercise over 5 sessions per week, or 75 minutes of vigorous exercise over 3 days during a week. So that roughly translates into about 30 minutes of high-speed walking on uphill most days of the week.
I think Europeans mustn't work as hard as us here in New Zealand, because who do you think's got time to do 30 minutes
to be honest,
hard working?
I generally actually tell my patients we need to aim for 15 minutes of brisk walking during most days, minimum of 3 to 4 sessions per week, but obviously that's not quite enough. But remember, my patients are mostly the ones with cardiac disease, so it's not quite the same as for a healthy population.
Right, so you've just alluded to the patient with heart disease. Tell us a bit more about what you're recommending in the heart disease patient, because obviously it's a bit different, isn't it?
Yes. So firstly, when we talk about exercise, people might think weight training is also part of exercise, same as jogging, running, cycling. So they do divide into endurance training, which is continuous aerobic exercise, which has huge benefits across all different age groups, ethnicity, gender, for the fact that it reduces cardiovascular and all-cause mortality and reduces adverse events by about 20 to 30% in everyone.
Yeah, I noticed in those guidelines I had to laugh because it had the aerobic training at one side of it, which looked like the best in it, and the other was leisure activities, which give you exercise. And it had low, medium, and high benefit, and it put golf as low benefit. I noticed
Yeah,
that.
there's a reason for it. But coming back to the resistant training, I think it is also important because you do need to keep your muscle bulk in big joints like shoulder and back, spinal area, because fitness is a component of different things, not just cardiopulmonary function. And when you talk about golf as a low intensity exercise, the main reason for that is it doesn't use large groups of muscles, leading to sustained substantial increase in heart rate to get that cardiovascular benefit.
Yeah, when patients say to me, "Oh no, I'm really active, I played golf and I'm active around my property," I say, well, that's like having a car. If you had a car that stopped and started all the time, you probably think that it might need a good blowout every now and then. And I said, and I think that you should say to the patient, look, that's all good that you're doing those things, but you need to give your heart a good blowout every now and then and go for a decent walk. And people do understand that concept, so I think that's quite useful.
So importantly, firstly, for cardiovascular benefit, we focus on continuous aerobic exercise. And then secondly, there is an intensity question, and what is low intensity, what is moderate, what is high intensity. I think one thing to be aware is that we are seeing patients who's being fully assessed from cardiovascular perspective. Whereas if you from a community seeing someone with risk factors who has not been assessed, or they may have undiagnosed advanced cardiovascular disease, there is a very small chance, and especially if they have a previous sedentary lifestyle, suddenly starts vigorous exercise, very small chance of adverse events happening in these patients.
So what is the GP going to do if the patient comes in and says, "Doctor, I want to turn over a new leaf. They're many pounds overweight, they haven't done any exercise for a long time, and they've usually got, some of these people have got an intense personality and they just want to get into it." What do you tell them? How should they start, or how should they go about doing some exercise?
Right, I probably would recommend to start on low intensity exercise and see how they feel. If that brings on any symptoms, exertional symptoms suspicious for cardiac cause, they probably should be assessed by a cardiologist first to see what their cardiac function is. And most of the time in our setting, we actually know what their functional capacity is from a stress test. And just briefly talk about low intensity. In most of our patients, we actually recommend low to moderate intensity exercise. So low intensity means that they're achieving up to 55% of age-predicted maximum heart rate. For example, so age-predicted heart rate is 220 minus the age. For example, in my age group, my heart rate to aim for, if I was doing low intensity exercise, is around about 97, 98, under 100. And that's generally walking on a flat. And if I was doing moderate intensity, then you can increase the percentage of the heart rate to roughly about 55 to 74%. Again, this is not quite the expectation of 85% that you see on the treadmill test. So that goes roughly in middle age group of patients around about 130 beats per minute for moderate intensity.
Right. Well, what about people with bad heart conditions? So like the heart failure patient, or the person who's had a heart attack and has got a lot of heart muscle damage, is on all these medications and drugs. What sort of exercise program are you going to recommend for them?
So I think we have to be quite careful with those patients with a more than moderate left ventricular impairment. If they are medically optimized, often they are on a beta blocker as well, and the heart rate may not go up because of the drug effects. I think these people, if you know they are fully revascularized and medically optimized, we know their functional level on previous exercise tolerance test, I would say, guided by their personal feelings and symptoms, do what they can, but do not do any strenuous exercise that's out of their capacity. And if they have symptoms, they probably should retract a little bit.
Yeah, I agree with that. I just tell them, look, go walking. If you're puffing heavily, that's way too much. If you're puffing a little bit, that's all right. And if you're not puffing at all, you're probably not doing enough. And that's sort of a simple thing that people can understand. What about measuring heart rate? Do you think everyone should be having one of these little monitors on every time they go for a walk?
No,
or
I don't
do
think
they need
so.
an Apple Watch, or what? How do they know what their heart rate is?
No, you definitely don't need an Apple Watch when you go for an exercise. I think normally it'd be guided by your physiological cardiopulmonary sort of manifestation. In other words, whether you're short of breath or not. I think when you're short of breath, you're probably achieving a reasonable amount of workout.
Yeah, no, I agree with that, because I don't think everyone needs to go out and buy a heart rate measuring device. Are there any other groups where you have to be especially careful? What about people who've got, like being monitored for an aneurysm or something like that? Or,
sure, I think those belong to specific disease groups, those with aortopathy, channelopathy, arrhythmia, other structural heart disease. They will have very specific guidance for exercise they need to achieve. There is actually a very good guideline by the European Society on these disease groups, and we might do a more detailed session on this exercise guidance in specific cardiology patients.
Yeah, I think the message to the GP is, look, if the patient with that sort of condition asks you what they should be doing, and the cardiologist they've seen in the hospital or wherever hasn't said that, you really need to get that information for them, because it is actually a little bit risky for those people to do very heavy exercise. In specific groups like patients with hypertrophic cardiomyopathy, all these unusual things, you really need an exercise guideline from the specialist. A lot of specialists don't really give that, or it's something that scant attention is paid to. Well, it's been a very interesting discussion, and we'll all go out and do our 30 minutes of exercise per day, will we?
Yeah, absolutely.
All right. Thanks for listening.